We can talk to Labour councillor Ciaran, and he recently described the lack of NHS dental care in the town as a scandal. Good morning, Ciaran. And I guess nothing's got any better in that time.
No, you're absolutely right, Claire. In that time, nothing at the moment has improved, and this is an issue that's actually been going on, as Matthew says, actually for 4 years. I first raised concerns in 2022 because I used to be the chair of the Health Committee and met NHS England to talk about dentistry. And since then, I haven't seen any tangible improvements. And residents tell me, exactly as Matthew has said, trying to get access to NHS dentistry is really difficult. You go onto the website at the moment for NHS and it has none. There are no NHS dentistry being offered to new patients in Weston. And Matthew was absolutely right as well. Those individuals currently that have had our NHS access before are finding their practices moving to private more and more.
Yeah, I mean, as a politician, if you like, do you have any sway over dentists being NHS or not? Do you have any say on that?
Sadly, not is the brutal reality of it. So the way kind of dentistry works is NHS England kind of negotiates the NHS contract with the British Dental Association, and from there the integrated care boards, so the local integrated care boards, then commission those services locally. We as politicians, particularly on local councils, have no ability to commission dentistry. Our role is really, we're there to champion our residents, and that involves shouting about this absolute scandal that we've got going on at the current moment in time. The government's saying, we've got this dentistry plan. It all feels quite late, though, because an awful lot of people are saying, look, we can't get an NHS dentist now, And I was told 2 years ago, so in 2022, that there was a dental recovery plan in the works. It would help have some tangible improvements. And sadly, as you say, that is yet to be published. I do understand that they are intending to publish it in 2024. I don't know when in 2024, but a lot of dentists I've spoken to who have left the contract or considering leaving the contract, it's probably too little too late for them. We need to try to entice them back to NHS contracts. And I think that involves having to urgently change the way that contract is structured. It needs to try and incentivise... Yeah. Go on, sorry.
No, you go on. Try and incentivise.
So I think we need to try and incentivise those dentists who have left for private practice back to the NHS contract. And that's through a mixture of things. It is certainly an uplift in the funding they receive. They do say that the pay for it is difficult. It is inflexible, is another piece of feedback that I am given. And it's overly complicated for them to do. But we also need the contract to incentivise seeing new patients. That's something the current contract, from what I've been told by dentists, doesn't do.
Yeah, and what is your understanding of why so many NHS dentists want to work in private practice instead?
So from what I've been told, the diminishing workforce, if you will, for the NHS dentistry, a lot of it is around dissatisfaction with the NHS contract, whether that's funding and the complexities of it. It's also a lack of career development in that space and a lack of flexibility. That's what I've very much been told by dentists, and no one I've ever spoken to has told me anything different. And actually, other organisations like the British Dental Association, who you mentioned earlier, are saying that they have seen 3,000 dentists have stopped providing NHS dental treatment in 2022. So that situation will now be even worse.